Welcome to the University of Michigan Dentistry Podcast Series, promoting oral health care worldwide.
The object of this presentation is to demonstrate the use of a dental assistant during periodontal surgery. We will show from start to finish everything that an assistant does to assist the doctor during such activities. At first, we'll show the operating room completely set up by the assistant, then the seating of the patient, administration of the anesthetic, the assisting during the periodontal surgery, the placement of the sutures and the dressing, the writing on the record of the procedures performed, the instructions to the patient, and the dismissing of the patient. On the back table, you can see the rubber gloves, the necessary equipment to administer the local anesthesia, the dressing material, the study cast of the patient, the charting and the records, and the radiographs in the view box. This is the setup of the chair and the dental unit and the bracket table where the surgical instruments are located under the sterile sheets and drape that will be used on the patient. Mrs. Betty French will seat the patient, Mr. Harry Winston, Jr. The chair has already been placed in a reclining position, and this is the position from which I'll be operating. And she places a large drape to cover the patient and protect them reasonably well from any splattering, and also to keep as clean an area for ourselves during the operating procedure. And she also places a cloth sterile towel immediately under his chin. When assisting, we are concerned with procedures that save minimal time as well as ones that save maximum amount of time, such as the placement of the rubber gloves on the operator's hands. These are sterile and were contained in a sterile package, and I place them on my hands, and then Mrs. French will put them up over my cuffs without touching them, so then I can immediately go into the patient's mouth and start the procedure. She'll first hand the Explorer and the mirror, and she warmed the mirror in the mouth and on the alcohol torch over there so that it's warm and doesn't fog up when it enters the mouth. And you can see how she's removing the equipment and getting things ready to go as I'm examining the mouth prior to administration of the anesthetic. And the next thing we'll need is the cotton-tipped applicators for the administration of the local anesthesia. She had this sponge ready and applicator. We're going to be doing this periodontal surgery in the maxillary left quadrant from the first bicuspid to the central incisor. You've had this done before, Harry. We're going to do the same thing we've done before. Give you a little jerk like that. I'll go slowly. Just take it a little bit easy. But you could notice how she handed the cotton-tip applicators that were already soaked in a topical anesthetic. One was a dry end, and the other had the medication on it. And when she handed the syringe, it was in a working position so that my thumb could go into the holder and I could take a hold of the syringe and immediately go into the mouth as she removed the cover from the needle. I'm going to do a papillae injection in addition to the infiltration injection, so this is why she's all ready to go with the second syringe. As we know, one of the most important aspects of assisting is anticipation. And this is why an experienced assistant is so valuable, because she knows as well as you do what's coming next and has everything waiting and available for me. Evacuate there, Betty. Use the water stream, Betty. Go ahead. She rinsed out the topical anesthetic as well as any local anesthetic spill that was in the mouth to make it a little more comfortable for the patient. And I'm checking now to see if he's numb. Can you feel this at all here?
A little bit.
Just a little bit? Let me check the outside now. Is there any sharpness out here on this outside? Evacuate, Betty. Let me turn it back off now. You feel anything out here, not here? Good. Bard. Now, is this sharp over here on this? Okay, good. Notice how she hands an instrument at the same time she takes one out of my hand. So she has it held in her hand in such a way that she can take the instrument that I have as well as rotate her hand and immediately hand the new instrument that is necessary to assist. Evacuate. While she's evacuating, she's also placing the instrument on the chest of the patient, where we use this area as a bracket table. So we have both a bracket table and immediately underneath the patient's chin an area for the placement of instruments, so they're readily available to either the assistant or the operator. And she stands and watches, and anytime she sees an area that needs evacuation, she moves in, or if I request it, in just one word and she's there. Explore. Now notice how this exchange of instrument occurs. Lingual. Now, is there any sharpness in here at all here? Good. Evacuate. You can notice underneath my right hand is a sponge on the patient's chest. And if I use that sponge and get it too filled with red material or saliva, she'll get it out of the operating area and replace it with another one. One factor that is quite important during periodontal surgery is to, once you start, get in, get it done, and get out. And this is where an assistant is extremely valuable. Inside. With the high volume of air evacuation system, if you're evaluating on the buccal, you can also draw from the lingual. Now, Mrs. French noticed that I had a mirror that was messed up, so she automatically had another one that she warmed and brought into the area of operation and handed it to me with the loss of no time or my even hesitating on carrying out the procedure that is going on intraorally. And this is the mark of a good assistant, one that anticipates. In fact, sometimes anticipates even better than you anticipate for yourself, and has everything ready to go almost instantaneously. If you notice, she has a sponge right underneath your right hand that has been moistened. And that sponge, if you'll notice on occasion, will be used to wipe off the mirrors. And then she'll put it in the alcohol torch on top of the dental unit to warm it prior to handing it to me. Now, if you notice, Mrs. French handed me a pawel. Now, I've already completed the incisions necessary with the B12 blade, the Bard Parker B12 blade. And the next instrument I use is a knife curette, and she's worked with me for 3 years, so she had that ready immediately when I was through with the B12 blade, so I didn't even have to ask for it. And now with the evacuation from the lingual, I don't have to worry about any excess tissues in the labial because it draws through. I know the evacuation is making quite a little noise, but I hope you can hear the narration above it. As these tissues are now being removed, Mrs. French is picking them up as well as the liquid, so the tissue that's being removed around the teeth is going in the evacuation system and right out of the area of operation completely, which is a great assist. Now, Harry, turn your head a little bit. That's it, good. It's customary for assistants to sit during a procedure of this type. However, my assistants during this procedure will usually stand. And because they do stand, if I'm doing 2 quadrants in the mouth, one assistant will assist for one quadrant and another assistant for the other quadrant. Because it's a little bit rough on them to have to stand for an entire half of the mouth, the length of time that it does to carry on this surgical procedure. I think it's quite interesting at times to note the evolution that one goes through in the use of assistants. Because when I first graduated from dental school in 1954, there was emphasis on the use of assistants, but not as much emphasis as followed that period of time. And I went from 4-handed dentistry to 6-handed dentistry. And during surgery, many years ago, I used to use 2 assistants during the entire operation. Today I've modified that, and I don't know whether it's because I'm older and wiser or older and more tradition-bound, but I've developed an approach for using assistants during surgery where 80 to 90% of the time I'll use only one rather than 2 assistants as in the past. And I believe that there has to be some balance in the judgment one uses. Scaler. When making a decision as to how much assistance he's actually going to use during the various dental procedures that he'll be performing in his office. Go ahead and rinse with this. That way a little bit. So I don't think it's that important to emphasize that you have to use 4-handed or 6-handed dentistry, but rather that you should use assistants to as great an extent as you possibly can, consistent with your own methods of operation, and how well you can train yourself to use assistance and how well you can train the assistant to work with you. I think one of the characteristics of a dentist, and the reason he goes into dentistry, is his own independence. And that's why I don't intend to try to tell somebody how to use assistance, but merely to show them how I personally use assistance and hope that some way they can maybe see some approach that they can use in their own office with their own assistants to better increase their ability to serve the patients. This is what's nice about a videotape, is you get to see everything, and we all have problems at times just like anybody else. And if things don't go quite right, you merely keep on operating, keep on going, because you can correct it and straighten it out, and there's no problem with the patient other than he got a little red stuff on his chin. If you notice, this headlight that I'm wearing is very helpful during this type of activity too, because both the assistant and myself get in the way at times. Now notice how Betty keeps those mirrors coming in there. Not the other button. Okay, lingual, number 9. So she's been assisting quite nicely during the incision, the removal of the tissue, now the scaling and root planing procedures. All the time keeping the area very free of excess debris, so we have the visualization necessary. And Harry, turn your head a little bit more towards me. One thing I like to emphasize in talking about periodontal surgery and doing gingival surgery is that one of the most important aspects of this operation is to gain direct access and visualization of the root surfaces, so that they may be very meticulously cleaned and made as smooth as we possibly can get them, to increase the potential for healing and new attachment around the teeth, and hopefully at a more coronal level. Hi, everybody. Back to right. I've double checked, and I'm satisfied with everything. All right, back forward here. So we have the suture ready now. And hold that up away from his beard down there, Betty. Yeah, that's it. Betty has placed a knot in the end of that suture, so that when I pull, it doesn't go through. And I am going to use a continuous suture, and probably one individual suture on the distal of the first bicuspid, where we did a distal wedge procedure. Now you can notice how busy she is over there in that bracket table, getting everything ready for the next phase of the operation, and how she's back in here assisting me all the time. We don't always have a mustache and a beard to work around, but if we do, we just work around it, and you can see how she holds the suture up and away from. The mod facial do. There you go. Hang on just a minute. Now hold it. How you doing, Harry? You can see him nodding his head, so Betty must be doing a good job of assisting since we're proceeding well. But I've often said that if I ever had to go back to doing all the things that these gals do for us, I'd just absolutely quit the practice of dentistry. They not only increase our efficiency, they increase our quality of operation, and they decrease the potential we have of having ulcers. Now see how well she watches me and even gets the cord around behind my back? My collar gets out of line, she even puts that back in position once in a while. But now we've sutured the area from the left central incisor to the distal of the first bicuspid. And now we're going to be ready to tie the knot. And she has the suture shears ready to incise. And notice how she even picks off the end of the small end of the suture material that we just cut. Pick it up, Betty. Pick up the suture. Yeah, underneath that. That's it. I'm going to put one more suture in the distal this bicuspid to increase the apposition of the tissues on the distal. After we get this tied, we'll then go to the placement of the dressing material. The sutures are completed. We'll now place the dressing. Mix up 12, Betty. When doing periodontal surgery, it's possible to, on the basis of experience, know about how much material is needed so that the assistant then can mix the adequate quantity necessary without having too much or too little. And you can see there Betty's putting out the powder on the pad, and she'll now add 12 drops in the middle of that powder where she made a little hole, so there's a crater in the center of it to hold in the 12 drops. And this is Ward Wonder Pack dressing material that will be placed in Harry's mouth. And you can see how she rapidly incorporates the powder into this dressing material. One of the most critical aspects of this type of periodontal dressing material is to make sure that it is mixed relatively thick, and that after it's mixed quite thick, that it's rolled into a rope maybe 1/3 to 1/4 the size of a pencil, and that there's a lot of powder on that rope. And you can see how Betty's adding more powder to the dressing material now, getting it gradually more thick. And since she's done this many, many times before, she knows the consistency that's necessary, and she'll continue to add powder until it gets to the right consistency. During periodontal training, one of the more difficult things was to learn how to mix this dressing material. And after I once got that degree and license, I don't have to mix it anymore, and I'm thankful for that, and now the assistants have to do it. But it takes quite a little muscle to mix that well. Now normally during periodontal surgery, this is a time when 2 assistants will be used. Will be at the level of 6-handed dentistry instead of 4-handed dentistry. And about the time the suturing is started, the other assistant will come into the operatory, and she'll be told how many drops are necessary to mix. So she'll be doing this during the time of the suturing of the surgical site. So at the completion of the suturing, this dressing is immediately ready to go. This is a fast-setting material, so once it's mixed and placed in the mouth, it doesn't take very long for it to set up. if you notice now she's balling that up in her fingers, and she'll now roll it out into a rope. And sometimes I want it in one piece or two pieces or three pieces, and I want this in two pieces. So she'll roll it out into a rope, and she makes it relatively thin. As she's rolling it, you can see how she spreads her fingers. Then she'll cut it in the middle and hand one end of it to me. But if you notice when she hands it to me, there's a tremendous amount of powder incorporated in that dressing. And the reason for that is you don't want the dressing material sticking to yourself. Once it's placed in between the teeth and wedged in there mechanically for retentive purposes, you want it to stay there and not come back out. It does get embarrassing if you place that dressing material in between the teeth and push it in several areas, then you bring your finger out and it comes with you. So the powder on there makes it not sticky to your hands or your rubber gloves. See how she's dropping it, get a little bit of the excess, and then she hands it to me, and then I'll go intraorally. Do the dressing. Now here's where I overguessed a little bit. She did an excellent job of mixing that material, but I overguessed, so we're going to have a little excess left over. But that's no problem. It's pinched off and dropped. And as I'm pressing it now around the surgerized area, I place it right at the margin, a little bit apical to the margin of the flap, so that when I press it, I'm pressing the flap in against the teeth. And notice how she handed me a mirror and cotton pliers. Now with these cotton pliers, I'm pressing the dressing material interproximally, both from the buccal and the lingual. And this provides your mechanical lock. Now notice how she's standing there with a sponge and a plastic instrument. Now sometimes with the tweezers I'll remove excess dressing material, and sometimes I don't. And this time I won't have to. So she hands me the plastic instrument that'll be used to remove the excess dressing material, since we do want to trim it off so it doesn't interfere with the occlusion. It does cover the wound area and the sutures. Also, when you have a lot of powder on that dressing material, it doesn't adhere so much to the sutures. And since the sutures do have saliva and blood on them, and the dressing material has powder, it has minimal tendency to stick in the dressing material. So it isn't much of a problem when it's being removed, that the sutures might adhere to the dressing material. You can notice I'm trimming off the excess on the labial surfaces of these teeth, and Betty's picking up the excess material all the time. She's right there with the sponge. During this procedure, we would have the other assistant writing on the record, but since we only have one assistant with us, she'll go to the record now and write on there the procedures that were done, so I'll dictate it to her. Two and a half cc's of 2% xylo. WL and WB number 9 through 12. DW on 12. No osteoplasty. 1S and 1R suture. Now those are my own abbreviations for what we did. WWP. Bite on down now. Open. We check for muscle trim, check for occlusion, check for comfort of the patient. And now that Betty has it written on the record, she'll clean the patient's face off while I'm giving him instructions. Now, Harry, from everything we did for you today, you're going to have to expect some discomfort, little swelling, losing of blood for a day or so, and I want you to take it easy physically, baby yourself, do all the eating on the other side of the mouth, and use the pills we give you for discomfort. Now, everything I've told you, plus a lot more, will be on the instruction sheet you'll be given, and Betty will give this to you. So read the instruction sheet over carefully, and also remember that on there are both my office and home phone numbers, so if you need me for anything, give me a call. Betty is now cleaning off the patient's face, both extraorally and intraorally. You can see how she's cleaning off the teeth because they do accumulate a lot of red material on them. And she cleans around the face, even way around on the right side sometimes. My hands get as far back as the ear with a little red material, so she cleans them up very well. Now she's applying lanolin to the lips, because during the periodontal procedure we do an awful lot of tugging and pulling on that poor patient and on his lips, and it's quite comforting for him to have this lanolin on there. And she blots off the excess so his lips don't look too shiny after she's applied it, but it's a lot more comfortable for him when she's through. See how considerate she is of the patient? Now this is a mark of a good assistant. She's even wiping off the sweat from his forehead and over his eyes. And this is what goes on in the office all the time, and this is a part of the job an assistant has to do in the office, is to not only assist the doctor, but to make the patient as comfortable as possible, because that makes the entire operation then go more smoothly for everybody involved. Everything has now been completed, and the assistant will then put the patient forward, remove the drape, hand the instruction sheet that we talked about earlier to the patient, and this then completes a demonstration on the use of a dental assistant during periodontal surgery.
You've been listening to a presentation from the University of Michigan School of Dentistry, which is dedicated to supporting open learning and open educational resources. This recording is licensed under the Creative Commons. It may be reused and redistributed for nonprofit use. Please attribute materials to the University of Michigan School of Dentistry and redistribute under this same license. For more information on how this and other University of Michigan School of Dentistry recordings may be used, visit www.dent.umich.edu/license.